Hey everyone, so the topic for this presentation is going to be fasting, and we'll talk about different types of fasting and the benefits. We'll also talk about it specifically with respect to cancer, as both what the research says about it preventing cancer and then also its uses during cancer. So here we go. Fasting is basically a practice that's been around for centuries. There are a lot of different cultures and religions that practice fasting on a regular basis, incorporate that into their beliefs, including Ayurveda, TCM, and then also several indigenous populations on various continents indulge in fasting as well. So in Ayurvedic practice, fasting is seen as a reducing therapy that's needed whenever the body gets too heavy or congested, whether there's an imbalance of earth or water, or the body has low digestive function. And then in TCM, the purpose of fasting is to address stagnation, stuckness, which could also be equated as heaviness or congestion, and this stagnation prevents energy and blood circulation. So in TCM, that blockage may be physical, it may also be emotional. Fasting involves the abstinence from or severe restriction of foods or certain types of food, as well as beverages, and that's with the exception of water and certain herbal teas. And we abstain for a set period of time, usually several days, 2 to 3 days, sometimes more. And the precise process of fasting can actually vary slightly based on your discipline or your purpose. In many cultures, it's also common to perform a fast at the beginning of each season or to align fasting with the lunar cycle, which is approximately every 30 days. So the lunar cycle has a waxing moon phase, which is 14 days after the new moon. And in that phase, the moon is growing and our bodies are more inclined to receive nourishment. Then the waning phase, which is 14 days after the full moon, is when the moon is decreasing. So we naturally tend to detoxify physically and emotionally. And it's a pretty good idea to align, if you're going to do a fast, with that waning phase sometime in that 14 days. The benefits of fasting have been studied extensively. There's a lot of clinical studies out there with that, and we know that there are certain benefits that have been shown over and over in those studies. So general benefits may include increased energy, improved sleep, and improved mental clarity. Some of the specific physiological changes that we see: reduced insulin resistance, so that improves our blood sugar control, better blood sugar levels. Reduced inflammation, which we know is the root cause or contributing factor to a lot of chronic disease. Improved levels of cholesterol and triglycerides. Improved brain function, so that would mean that fasting has some potential use in prevention and maybe even treatment for neurodegenerative disorders. Improved blood pressure, which will help contribute to better cardiovascular health. Increased secretion of growth hormones that contribute to metabolism, weight loss, and muscle strength. And we know also from the studies that it may decrease the risk for certain types of cancer. There are different ways that fasting can be practiced, different methods that we can use. Traditional fasting involves drinking only water or herbal teas, non-caffeinated herbal teas, for a set amount of time, and that usually ranges from 24 to 72 hours. If you consume food during this fast, it should be whole foods, no processed foods, limited, very, very limited calorie intake, well below what you would normally intake for a day. Raw or lightly cooked foods, and it may include broths, juices, or herbal teas. It's really helpful during a traditional fast to use those broths and herbal teas and even sip on them. They're going to be very low calorie intake, but they can help to relieve some uncomfortable symptoms of the fast and help you sustain that fast for longer periods of time. So also with a traditional fast, a transition period is recommended. No excessive food or beverage consumption just prior to or after, so you kind of wind your way into it. Some of the different ways you can incorporate traditional fasting are to fast seasonally, and this is, again, very common in different religions and cultures, to fast at the beginning of each season. You can fast once a month, and that can be the beginning of the month, the end of the month, or like we said, you can tie that to the waning phase of the lunar cycle, because that's approximately every 30 days as well. And then I also know a lot of people that fast one day out of every week. So those are just some ways that you can incorporate a traditional fast into your lifestyle. A traditional fast is designed to be temporary and short term. Then there's also a practice called intermittent fasting or time-restricted eating. And this is the process where we alternate our periods of fasting with periods of eating, all within that 24-hour daily window of time. So the most helpful way to incorporate intermittent fasting, you do this every day. You set your window. It needs to be at least 12 hours, and it can be up to 18 hours, and this is your fasting window. So you're going to eat in the time outside that window. So you can eat in a 12-hour time frame, same time frame every day, and then fast the other 12 hours of that day or that 24-hour cycle. You can widen that fasting window if you want to. But again, it's helpful to kind of set this as the same time each day. And this is really good because you can actually align the window to whatever your wake, work, and sleep schedules are. So you can make that match your own individual lifestyle. So those physiological effects of fasting, what happens is it forces healthy cells to enter a mode of protection, and that means that they are dividing at slower rates. It also creates changes to metabolic pathways in energy generation and metabolite production. This is one of the reasons why it is beneficial for blood sugar and insulin resistance. It changes certain levels of circulating hormones. We burn up our stores of glycogen, which is glucose, and depending on how long your fast lasts, you will begin burning ketones and fatty acids. There's an increase in activities associated with cellular repair. It resets the gene expression for certain genes that may have been altered by toxins or stress. Then the other thing I wanted to talk about was differences in terminology, because when we think of fasting, there's other terms out there that get thrown around, and I want to make sure that we understand the difference between those. So the first is detox. When somebody talks about a detox, they are typically referring to a short-term process like a diet or a specific program, and not a fan. Detoxification is completely different from fasting. So fasting involves restriction of intake of nutrients, but to effectively detox, it requires specific nutrients in adequate amounts. You need to get macronutrients. You need to get those micronutrients. You also need fiber, and you're only going to get those things if you're eating, not if you're fasting. The other reason I don't like detox programs is because we need a detox every single day. We are constantly in contact with environmental toxins. We have toxins that might be present in our food. There might be viruses and bacteria. And then we also, as we digest foods and metabolize, we contribute our own waste. So we've got all these toxins and waste in our body, and we need to eliminate those every single day. So we need to be very conscious on a daily basis about detoxification. Rather than doing little quickie programs or specially designed things, we really just need to focus on getting the right nutrients in. The other term that you're going to hear sometimes is a cleanse, and that is usually referring to a program that's associated with drinking juices, doing herbs or supplements, and it's also usually promoted as a weight loss program or a quick way to eliminate toxins. And a cleanse is not going to effectively detox because it's not going to get all those nutrients. So if we're drinking juices, we're not going to get a lot of protein, we're not going to get glutathione, we're not going to get any fiber. So really, a cleanse is not a very effective way to help us detoxify those wastes and toxins in our body. So these detox or cleanse programs may or may not initially involve a period of fasting. You might see that sometimes they include a day or two of fasting to start with. The other thing that you might hear about is a colon cleanse. It's also referred to as a colonic or an enema. And this actually involves flushing out the large intestine, usually with some type of liquid, some like water. So a colonic or a colonic irrigation uses a tube placed in the rectum and the last few inches of the large intestine, and it flushes the colon with water. And then an enema empties the colon also using a small amount of liquid. It could be water, could be coffee, could be an herbal solution. But again, it's flushing out the colon. And there are some risks when you do this type of a colon cleanse or flush. To me, those risks will outweigh the benefits. You risk becoming dehydrated. You risk a perforation of the colon. You can change the balance of electrolytes, which is going to cause other health issues. And you could also alter gut bacteria. So that balance of gut bacteria might become imbalanced more towards bad or good. And you don't really have any control over those when you do these procedures. Then you have laxatives, and these are usually supplements, could be herbs, and they promote relaxation of tissues or elimination of water to assist in elimination of waste. But again, if we're getting the nutrients we need every day, then we detox our system every day. That's what we really need to be focused on. And again, that's completely different from a fast. So who should not fast? There are definitely some people that fasting may not be appropriate for. Anyone who's weak needs to be nourished. So we don't want to remove nutrients from their diet or their lifestyle. We need them to eat as much as they can to build up their strength. Certain elderly people, this is going to be an issue for. And it's generally not a great idea to fast if you're very elderly. Then you also have diabetics, and because it affects those blood sugar levels and insulin resistance, that needs to be looked at. And then obviously, if you're pregnant or nursing, you need all the nutrition that you can get to provide the nutrients for that baby. So anyone in any of these categories should only fast under the guidance of a trained health professional. What about cancer? As we talked about, a lot of the clinical studies have shown that fasting on a regular basis has been shown to reduce the risk for several types of cancer. Fasting has also been studied as a treatment approach for cancer, either standalone or as a supplemental therapy used with conventional treatment approaches. And both of those have been studied extensively as well. The studies that use fasting alone on cancer progression as a treatment approach have shown a lot of mixed results. One proposal for this is that cancer also disrupts our immune function, and so that could prevent some of the benefits that normally occur with a fast. The results may vary based on the gut health or microbiome composition of the individual, and it also likely varies based on cancer type and cancer stage. So considerations of fasting for a person with cancer. There are potential risks to cancer patients of calorie or energy deficits and also micronutrient deficiencies that need to be looked at. it is hard to adhere to a traditional fast, and you're already in a state of not being well with the cancer, so that may make it even harder to change up your lifestyle and do something like a fast. It's definitely contraindicated for someone with cachexia. So cachexia is actually a form of weight loss that is characterized by extreme muscle wasting, sometimes a loss of fat, and it's not a simple malnutrition disorder. There's a complex interplay of genes and genetic variations, as well as metabolism disorders. And so we don't want to withhold nutrients from people with cachexia. We want to do whatever we can to make sure that they don't get additional weight loss from something like a tradition of fasting. So definitely when you're talking to someone with cancer and we're looking at fasting, we need to consider their health status, their cancer type and stage, and determine whether it's appropriate to incorporate a fast into their treatment protocol. Fortunately, there are alternatives to fasting. There are some different diet approaches that you can use instead of a traditional fast that give you some of the same benefits. So one of these is called the fasting mimicking diet, or an FMD, and these are actually medically designed diets. They're very low in calories, typically range between 300 to 1,100 calories per day. They're very low in sugars. And then your nutrients are typically consumed using small portions of broths, soups, juices, nut or nut butter balls and bars, and then herbal teas, and may also include targeted supplements. So you're going to eat, but you're going to eat a calorie content that's significantly lower than what would be your normal daily calorie count. And you can tailor that so that the types of nutrients you're getting, you still get the same benefits as a traditional fast. Then ketogenic diets, which have become really popular lately, these are diets that have normal calorie levels, but they're composed with very high levels of fat, very low carbohydrate content, unfortunately also typically low protein content. The classic ratio for a traditional ketogenic diet is 4 portions of fat to 1 portion of protein and carbohydrates. It does reduce IGF, those growth factors, insulin, and glucose levels. It increases those circulating ketone bodies, so we start burning ketones instead of glucose. It has less effect on the cellular reprogramming or regeneration than a traditional fast. And the ketogenic diet was originally used for neurological disorders. It's been seen very effective for brain cancers, brain tumors, epilepsy, things with a neurological basis. But it's very, very hard to maintain a traditional ketogenic diet. So a lot of the people that are practicing, quote, ketogenic diets they're really doing modified diets. So they do have higher levels of fat, but they also tend to have higher levels of protein and even higher levels of carbohydrates than that traditional keto diet. Not to say that that still doesn't have its benefits. Again, you have to look kind of at your individual status, and genetics is going to play a part there. So then we also have chronic calorie restriction called CR, and CR diets also involve a reduction of calories from the normal calorie intake that we would have on a daily basis to maintain healthy weight. And that reduction can vary anywhere from 15% to 40%. There's also diets that eliminate or reduce specific proteins, like saren is one, methionine, asparagine, and glutamine. And these have been used with specific, I won't say specific types of cancer, but looking at the cancer cells themselves and the signaling mechanisms that they're using tend to use certain amino acids. And so if we target those signaling mechanisms and remove those amino acids that they tend to use, then those types of diets have been a little bit successful in treating certain types of cancer that have those signaling mechanisms. Then there are also a lot of studies out there specifically related to fasting during chemotherapy. And this is actually a pretty cool thing. There's a lot of evidence that suggests that combining fasting around your chemo treatments can improve the efficacy of the treatment and reduce side effects. So what happens, that we said, is that normal cells go into like a protective mode. So they're not dividing, they're not growing, they're not as active, they're kind of not hiding, but staying dormant, if you will. But cancer cells don't like these signals. They want to grow, they want to divide, they want to be active. So that makes them targets, basically, and more susceptible to the effects of the chemicals from the chemotherapy. What that means is that you're going to have less side effects because more of your normal cells are going to be protected and more of the cancer cells are going to get targeted. And so you also may be able to reduce either the dosage or the time that you have to do chemotherapy. So really, really a cool thing. And so as we said, the fasting is actually performed around the chemotherapy treatment sessions, and it should begin at least 24 hours before. It can go up to 48 hours prior to the treatment. And then it should continue 24 hours after and up to 72 hours after. Now, obviously, you want to work on, you want to do this with respect to your own health status, what's going to be appropriate for you. And some people just can't abstain from food and shouldn't abstain from food, even though, it definitely has those benefits. So this is when you might look at like an FMD or a CR, one of those modified diets, to kind of get those same benefits. Right, so we might be able to get the same benefits by doing a different alternate approach if we can't do a traditional fast. Again, you're going to be doing this with the help of your health practitioner. You're not going to be doing this on your own. So FMD or CR can be used. A KD, the ketogenic diet, might be appropriate if the cancer is neurological in nature. And again, we talked about those diets that may reduce or eliminate certain proteins. If your cancer pathology indicates that those signaling mechanisms can be targeted. To recap, fasting has been used for many centuries across multiple cultures. You can align the fasting to seasons, months, or the lunar cycle. We know it provides benefits for blood sugar management, cardiovascular health, brain health, and cancer prevention. Traditional fasting is the abstinence of food and most beverages. Intermittent fasting alternates a feeding window with a fasting window every day along set times. Fasting is not the same as a detoxification or a cleanse. It may not be appropriate for everyone, may be successfully used in cancer treatment, and definitely has some benefits around chemotherapy sessions in order to reduce toxicity to normal cells and increase toxicity to cancer cells. Okay, that was fasting. Hopefully that was information that's helpful for you, and maybe you might incorporate fasting into your lifestyle, achieve some of those health benefits, and everybody be well. Take a look at some of the other videos I've got. Thanks, guys.